My name's Liz Ashall-Payne and I'm the Chief Exec of ORCA. ORCA stands for the Organisation for the Review of Care and Health Apps, and we're all about helping activate patients, populations and professionals to be able to find the best apps. The reason I got interested and passionate about health apps was because I was adamant that I wanted to try and help support more people to be able to achieve better health outcomes. And starting out my career as a speech and language therapist, I knew that as a clinician I could only help one person at once with my clinical intervention. So I got really interested in looking at new ways of working and saw health apps as an opportunity to be able to scale great healthcare solutions in a way that other interventions don't allow us. The problem was I wasn't sure which apps to use, and I wasn't sure whether I could trust them. And so I knew that if I was asking these questions, I knew other people would be too. And so I was absolutely adamant that we needed to find a different way to empower professionals to know which apps are safe, to empower people to be able to trust apps so that they can start to embed them in their lives so that everybody can get a benefit. The challenges that we've faced at ORCA are challenges that we all face in this world of health apps. The first is people aren't always aware of the opportunity that's out there when we're talking about health apps. So when I tell people that there's over 327,000 apps, people are surprised. People's awareness of what the opportunity is quite low. The second problem is access. Where do people go to find and use and download these apps? The app stores just don't work. The third big problem is trust, and that's not unfounded because there are some bad apps out there on the marketplace. And the fourth problem is governance. How do we manage risk? If we're really going to embed health apps into clinical practice, we need to manage the risk along that process. And so it's those four big problems that we at ORCA are really trying to support and break down the barrier to. At ORCA, we think that the biggest transformation that's happened with digital has been the engagement. So there has been a lot of advances in technology and digital innovation, but the big difference that we've seen is the engagement in the workforce and in the end user. So you can throw technology into any environment, unless you've got a ground that's ready for that technology, it won't work. And I think what we've seen in the NHS and further, we've seen a readiness that we haven't seen before. I think that the ground has to be ready because if you just put a computer on somebody's desk but you don't teach them how to use that computer and you don't explain the benefit that they'll get from using that computer, then they're never going to use it. And I think if we go back 10 years to probably when we were all starting to own smartphones, I don't think we probably used the majority of that smartphone device, and now 10 years later we've started to feel more confident, and I think that that's where we're at with using digital health. People are ready to start trying it, probably still only using 10% of the opportunity, but I think that that opportunity will scale quite quickly now. The largest barriers that the NHS probably have today in using digital health is first and foremost our ability to change quickly. Second, our ability to change whilst maintaining what we already do. So if you're a frontline clinician and you're having to see, let's say, 10 patients in a day, but you're also being asked to change the way in which you deliver that care, where do you find the time to learn and embed a change? That's probably the biggest challenge. I think the other challenge that we have is a culture shift. What we're trying to do now is shift the culture from one of focusing on people's ill health to one where we want to focus on people's health. And that's a bit of a culture shock, not just for the NHS, but also for us as consumers of our own health. And I think that we, as consumers of our own health, have to think differently about how we look after ourselves. So I think that it's probably not the technology that's the biggest challenge. I think it's probably some of the other more difficult areas that are the biggest barriers at the moment. I think there's going to be a few significant changes in healthcare with regard to digital health over the next 12 months. I think the first is people and patients and professionals will really start to embed digital health into everyday work, life and practice. I think the second is we're going to start to think about supporting the workforce in a different way and making sure that we've got a workforce that's ready for this digital future. And then the third thing is I think we're going to start to really think about the way in which we integrate the data in new ways to really benefit health outcomes. Okay, so the opportunity we have currently with health apps is that there's currently 327,000 health apps available to us, and every day 5 million people download a health app. So our consumers are already using these opportunities. And when we ask healthcare professionals, over 90% think apps could help their patients. And then when we look at how many smartphones there are on the planet, well, there's currently more smartphones than there are toilets or toothbrushes. So that's the size of the opportunity. The challenges that we have to overcome is helping people first and foremost know that they're there. We need to give them a place where they can access these apps. That place needs to be trusted. And we also need to embed these health apps into care pathways and provide a way of managing risk in using apps in clinical care. One of the big things that I would want to say to anybody thinking about using digital health or thinking about how to use digital health either as an NHS organisation or in another health and care environment is to have a go and start the journey. This is a journey that we're on, and we've got to start somewhere, so be brave and take a jump off the cliff and start having a go at using these technologies and learn on the journey. And it's okay, you won't always get it right, but let's start making our way through this jigsaw puzzle. So to my healthcare professional colleagues, I would say open that Pandora's box, take a look inside, see what digital technologies are available to you for you to embed into care pathways for you to use with your patients. One of the things I can say about health apps, if you can think of a condition, you can think of an app. There's an app literally for everything out there. Then really try and understand, is this app something that I can trust and use with my patients? And obviously we can help with that at Orca. We've reviewed these apps. If the app that you're interested in isn't on our site, get in touch and we will put it through that review process. But start to think about how digital health can be embedded into the care pathway, because I can probably guarantee that a huge number of patients out there are already using health apps. So what we want to do is try and empower them to use good health apps. Now for industry colleagues, I think that their biggest challenge is really thinking through what does the end user need and want, and how will this be embedded into care pathways. So my advice to industry is go and talk to patients, go and talk to people, go and talk to professionals, ask them. And the other thing is it won't be perfect when it first launches, so keep asking. And the other thing is our populations keep changing, our expectations as consumers of our own health keep changing, so keep asking and iterate your product to meet the needs of the people you're trying to benefit. One of my key messages that I really want to say to people is one app will never fit everybody. So whether you're wanting to design an app or use an app or embed an app into your practice with a patient, just be aware that one app won't meet everybody's needs. And I'm going to give you an example. So I'm diabetic. I was diagnosed with type 1 diabetes when I was 30. And on that day, it was a shock. I hadn't ever experienced that before. Nobody in my family had type 1 diabetes. And what I needed at that point was a tool that gave me education and information about my new long-term condition. Now that was over 10 years ago now, and I'm well educated and I'm well informed, but I'm still type 1 diabetic. And now the apps that I use are apps that help me to monitor trends and data flow so that I can manage my condition very well. So although my clinical condition is the same, the app and the tool that I use are different. And it would change again depending on my personal preferences. So if I had a hearing impairment, I'd need a product that would meet my needs as a hearing impairment, as somebody who had a hearing impairment. If I decide to go out and buy a specific wearable and I want it to work with that wearable, I might need a different product. So my overriding message is, please think about how you embrace the landscape of health apps and the landscape of high quality health apps, rather than just trying to pick one and give that to everybody.